Welcome to our talk show, and thank you for joining us this evening. And as it was advertised today, we're talking about something very special for the ladies, and I'm hoping you're going to enjoy this topic. And we have a professional for that, matter. I can be talking about these things myself because I think I need them as well. Figile, welcome. How are you doing?
I'm doing good. No, thank you. Thank you. Welcome. When you say it's for the ladies, I'm
Mm,
asking myself, where
mm.
are you putting yourself in this one? Because, hey, treatment is for all of us. We all need to treat ourselves. How? We've got a guest speaker today. Tell us, please introduce our guest speaker today, Noah.
Before I introduce her, this show is
Please.
going to dispel all this. What do you call this? Um, you know,
You're asking me.
yeah, I'm asking you, man. That word just went out of my mind.
It's not a
But
simple English word, eh?
hey, this English is too hard for us. But some other
It
things,
is. But we'll wait for our speaker to tell us what it is
yeah,
then.
yeah. But some other things, we thinking that are for the ladies, but we as men as well need the treatments. We have the same skin, maybe. Dr. Leseho, who's our special guest this evening, will explain that if I now with this kind of skin do need the treatment. Dr. Leseho, welcome
Mm,
to
mm,
our
mm,
show.
mm.
How are you?
Thank you. I'm very well, thanks. How are you?
I'm fine, thank you.
We're doing well.
Dr.
Thank
Leseho,
you.
we've been waiting for this moment to come. Tell us, please. Tell us, please, what is aesthetic
Before
treatment?
she can tell us about the treatment, let her introduce herself properly. Because me and you, we've got this tendency of not introducing our guests because we know them personally. So, Dr. Lisejo, tell us about you. What is it that you do before we can even move forward?
Yeah.
Okay, so my name is Leseho Khanzi. I am a medical doctor. I do lots of different things. I've had a very varied path. I'm an aesthetic medicine doctor. I'm also a qualified epidemiologist as well. And I also practice quite a lot of general practitioner medicine with a special interest in HIV. So today we're going to be talking especially about my love of aesthetic medicine. And I want to say one thing that I need to correct about what Noah said. Aesthetic medicine is not just for the ladies.
Yeah.
Aesthetic medicine is about making everybody feel good. Very, very important. It's for everybody. Okay.
Guess what,
Thank
Dr.
you.
Lisa?
That's you came to our rescue, doctor. Please.
Yes.
Guess what? The, the term came to my mind. The stereotype. That's what I was looking for.
Oh, yes.
Yes.
And you should have
That's
said me. Me now or the stereotype.
So please tell us then, Dr. Lisio, about the stereotype. What is this aesthetic treatment? Maybe before we get to the, allaying the stereotype thingy, just tell us what it is actually.
so aesthetic medicine is a relatively new kind of medical field. It's really developed and boomed in the last, say, 30 to 40 years. And initially, people used to think that it's just about doing Botox and fillers and making you look pretty, but there's a lot more to do with it than that. It's about helping people really be the best that they really can be. You know, for example, I treat a lot of people who have problems with excessive sweating, for example, where you would use different modalities to try and help them to stop sweating so much so that it actually doesn't affect their daily lives. There are people who literally don't leave their houses, who cannot get a job because they sweat so much, you know.
Wow.
I do a lot of scar treatments, for example, where people don't want to interact socially because of scars, you know. And so that's really what aesthetic medicine has really evolved into. It's really treating things that you can see in order to make that person be the best that they can be. So it encompasses things like botulinum toxin treatments. It encompasses things like, for example, post-op, if somebody has one eyelid that is slightly lower than the other, and it's going to impact their life, where you would help to correct things like that. It encompasses so much, So that's why I'm saying it's a lot more than just making you pretty.
Wait,
You
doctor,
know,
you
you
say
touch
a lot
something
of
nice.
people. You said a lot of
Carry
people
on
are
now.
having a problem with sweating. Isn't that
Yeah.
a natural process for the skin to or the body to cool itself? And when you're doing that aesthetic treatment, are you not disturbing the flow?
So yes, you're right. Sweating has a natural place in life, but when that sweating becomes a physical problem and eventually also a social problem, then that needs to be dealt with. For example, you have people who will have such a major reaction to presenting to a client, for example, where their shirt will literally be wet, where
Yeah,
they will have such terrible body odor that they can't be in a social interaction. And that obviously then impacts on their income, it impacts on all of their social interactions. So in an instance like that, you actually need to help that person. So you would treat the area that they're most affected. So if it's, for example, their underarms that are the biggest problem and their hands are not such a big problem, then you would say, okay, fine, let's choose the most important area to you. Let's treat the underarms. We know that you can live with the hands, and then you would treat the underarms in that instance. So there are lots of different things that you can do in a medical way, but to help that person with that specific problem. Obviously, you would then have to examine the patient, take a good clinical history, make sure that whatever it is that you're doing medically is correct and safe.
wow, that's another way of
Wow.
looking at it. I thought it only applies to the face. I didn't know it
To
goes
the
that.
No, no,
face,
no.
yes, same here. I mean, I'm a woman, but I thought you only deal with the face. You're making us look pretty because we only know the Botox, lifting our chins, all this layers that we
Yeah.
need correction as ladies. I know that guys do need those. But now tell me, Doc, does this require surgery or is there another way of doing it?
So it depends on the patient presentation. So as an aesthetics doctor, I don't do surgery. That's left to plastic surgeons. So if I assess you and I realize, listen, this is a surgical issue, then I refer you to a surgeon, you know. But for example, if it's somebody who needs hair restoration and it's something that can be done with medication, then that's how I would then treat you. But if it's something where the person would need surgical intervention, for example, they have a major scar or excess skin that needs to be surgically cut out, then you would then refer that person to a surgeon to get that surgically corrected.
Okay. Right.
Yeah.
Before we
Okay,
go further,
that's nice. Very interesting.
can I play one of your promo videos? Maybe it'll also
Sure, please.
open up what you do to the audience, and then they can engage with us.
Absolutely.
Let me welcome those that are connected on Telegram. Welcome, guys. Thank you for joining us on Telegram. We're also streaming live to Twitter. And if you're looking to join us on Twitter, this is Neomorabid Production. Look for that, and you'll see our live streaming on that. So, Dr. Lesio, let's continue our discussion. I'm very interested in this. I'm learning new things from you today about this aesthetic treatment. I read through a little bit about it, but yeah, I saw there were a lot of treatments that goes under this cosmetic treatment. What can you tell us about it?
So let's start with the most basic thing, which would be just general skincare.
Yeah.
Everybody needs to take care of their skin. there's this one fantasy that we all have, and it's like black don't crack, right? I
Yeah.
can tell you right now, black does crack. We all crack. So please take care of your skins. The first thing that everybody needs to do, no matter what happens, is use sunscreen every day. We live in South Africa. We have a lot of sun exposure.
Mm-hmm.
We need to make sure that we take care of our skins, avoid skin cancers, all of that sort of thing. Okay?
Yeah.
The second thing is all of us want to look our best. We all want to look as young and as healthy as possible. So it's important to make sure that we use a good skin regimen. Ladies, gents, everybody who uses makeup, make sure that you remove your makeup every day. Make sure that we're not too harsh with our skins. We're not, putting lemon juice on our skins and all of these funky things that we like to do. Please, let's just be gentle with our skins. Drink enough water. Do all of these good things just to make sure that we take care of our skins. That's everything that we need to do before we start doing skin treatments. Right. Then we come to the most basic of skin treatments, which would be something like a chemical peel. So chemical peels sound horrific to people who've never had them before.
Yeah.
No, it doesn't mean that we're going to be burning our skins. Chemical peels are really just a chemical way of exfoliating the skin. Back in the day, we used to take really abrasive, sand-like products to try and abrade the skin to try and get it as smooth as possible. We don't do that anymore because we know that that physically damages the skin. Now we use nice, gentle fruit acids and also some of the synthetically created chemicals as well to try and create the same effect, but get a better outcome. So that's what chemical peels really are. You also have your more herbal type ones, for example, the green peel, which I love. For me, it's almost like a skin detox. I do that every month, and that's another really nice product. I actually have a lot of male patients that love having green peels every month. That's their downtime every month.
Okay.
So yeah, that should be the entry level, I suppose.
So are you saying I must come for the green peel?
Come for green peel. It's your downtime. You have a quiet time. People fall asleep while you're doing it. And then you wake up, you feel refreshed, and you look refreshed as well.
Oh, that's so nice. Figile?
Yeah.
Now tell me, Doc. We feel oftentimes than not, we feel that taking care of our skin can be costly. You mentioned a lot of things. I dislike you right now because I just put on makeup for our show. Now you're telling me that I have to remove it when I go to bed. I mean, all this makeup
Yes.
is going to waste. So now we often believe that taking care of our skin is expensive. As a doctor, what can you tell me as a normal person?
Taking care of our skins does not have to be expensive. It's exactly like I said. We need to eat a healthy diet. We need to make sure that we drink enough water. We need to make sure that we use sunscreen. And I don't mean sunscreen that costs thousands of rands. A basic sunscreen that's at least an SPF 30, that's all that needs to be done. After that, we need to make sure that you moisturize your skin every day. That does not need to be expensive. If you take care of your skin, whatever else it is that you put on top of it, whichever makeup it is that you use, whichever makeup brand that you use, doesn't even need to be expensive because your underlying canvas is healthy, So skincare does not need to be expensive. All the other things are really like add-ons, It's a cherry on top. That's a treat that you give to yourself for working really hard.
But Doc, where
So
was
now,
this
when
treatment?
does it get expensive then?
Okay, yeah, go for it.
So,
Because
so
if
look,
I'm
yeah,
doing the basics, I'm avoiding it to
yes,
get expensive. So when does it
yes.
get expensive? Yes.
So when we start to age, then it does start to add up. For example, if one then starts to have very saggy skin, for example, and we've got a lot of skin laxity, that's when we want to start looking at doing things like biostimulators. That's when it starts to get quite, I suppose it could get really medical and scientific then. So you get lots of different biostimulators that are available on the market. that aesthetic doctors do as injectables. Once you inject that underneath the skin or into the skin, actually, what they do is they cause a mild controlled inflammation in the skin. And so then your own body recognizes this controlled inflammation and says, hey, I need to get rid of this inflammation. So I'm going to do that by creating more collagen and creating more elastin. And what does that do? It regenerates your skin by causing its own inflammation. And that's amazing. So then that means that we start to reverse the aging process by almost tricking our skins into creating its own product. So that is a costly process, but it's a whole lot cheaper than starting to have facelifts, for example. And it's natural, it looks more natural. So for me, I mean, I'm loving biostimulators. They look great, they look natural, they don't have a strange appearance. And that really is the new big thing in aesthetic medicine.
Can I jump in? So, Doc,
Yes.
Jump in now before I
um,
jump in.
I see a lot of celebrities are going for skin treatment, and the most that I've seen, well, excuse my stereotype, angle of this, but the most that I've seen is Botox. Is Botox part of this, or it's a different type of treatment that it doesn't go under?
So it does. I think let's put it like let's go through each individual skin treatment, then it'll give you a better overview of what's what.
That's fine.
So
Yeah,
let's start
yeah,
with
please.
Botox. Yeah. So Botox it's a neuromodulator. So what Botox does is it just makes your muscle a little bit relaxed
Mhm.
so that it doesn't cause contraction of the muscle. So for example, if I have a wrinkle next to my eye, that wrinkle is made by the muscles around the eye contracting, right? So if those muscles are always contracting, they're going to make the skin fold. So if I can make those muscles relax, then the skin won't fold. So that will make sure that the wrinkle then goes away. So that's exactly how Botox works. It just makes those muscles relax for anywhere between, well, we say Botox as a generic term, but there are lots of different products that are of the Botox family. So they would last anywhere between like 3 and 6 months. And so then you have a nice flat surface for 3 to 6 months. And I think that's lovely. I just love that. So then you look fresh and wrinkle free for 6 months of the year.
Okay, you said for how long does it last? If I do
For,
a Botox today, for how long will it last?
so it'll last you anywhere between 3 and 6 months, depending on the type of product that you use. And it will
Okay,
start
okay.
working around a week after you've had the injection. But once it starts working, man, you just look fresh, and that's lovely, you know.
Sounds
So
fantastic. Now I want to find out, Doc. Sorry to cut you. If it happens that I stop the Botox, we know that with most treatments, if you stop it, you already messed up whatever your skin
The system.
can go through. So if I cannot afford to go for the Botox, and I stop that treatment, what happens with my body? What happens with my skin?
so then your muscles just become active again, and everything goes back to normal. You don't become worse in any way, and there's no major complications. So you just go back to the original you. That's it.
No.
Okay, so
Okay,
there's
all
no
right, all right.
harm
You may
in
continue.
skipping a treatment. For example,
Mm.
we don't Botox pregnant ladies, right? And I have quite a number of pregnant patients at the moment, actually, who are due to have their next Botox treatment. And I've had to say to them, well, no, you can't have it now. You'll have to wait until you've had baby. And also after you finish breastfeeding, then we'll think about redoing it. And so they've just gone back to the original them, and we'll just start again later, and it's okay. It won't do them any harm not to have it for a year or so. You know. So
Okay,
So what
that's
would
very
so that's
interesting.
the. Mhm.
so what had happened when Botox gone wrong? I mean, I'm so sorry. You know, watching TV can give us wrong information or sometimes accurate information. It gets you well informed on the subject. But now we've seen TV shows where Boto's gone wrong. A person is forever smiling, even if they're crying, but you see them smiling with the tears rolling down their eyes. What had gone wrong that you have such a um, disadvantage?
Yes. So the big thing is whenever you do any treatment, whether you're having an aesthetic treatment, whether you are having eye surgery, whether you're having foot surgery, you need to go to a qualified doctor. You
Mm,
need to go to an experienced practitioner, you know. So it's the same thing with aesthetics medicine. It's really important to go to a qualified aesthetics doctor who is registered with AMSA, our Aesthetic Medicine Association of South Africa. Then you know that you have somebody who has regular updates, who is experienced, and then the risk of complications is very, very unlikely because they keep up to date with the newest trends, and these are people who also are trained in how to properly manage complications. It's very unlikely that you will then appear on botched, for example, looking all strange, you know. So that's really the message that I would have. You know, it's also very unlikely that you would end up being over treated and over Botox because this is a doctor who would know what they need to do.
mm,
You know,
Yes.
yeah. So, guys, so we I suppose that we've spoken about Botox, the neuromodulators, and then the other commonly known one is in fillers, right? So fillers are a lovely, they're really good modality for treating patients who have volume loss, whether it's in the face, whether it's in the hands, for example, because that's also another telltale area where we start to age is our hands. Whether it's the nose, it can really be used anywhere, you know. But fillers have often gotten a bad rap because it takes a lot of skill and a lot of experience to use fillers. And I think also because there have been a few cowboys who have, you know, done things in an unregulated way,
mm,
fillers have gotten a little bit of a bad rap. But in good hands, fillers really can make all the difference, especially in people who, for example, they have asymmetry of the face for whatever reason. They've had a dog bite and the one cheek is smaller than the other, or there's some other defect, or somebody who just, you know, they are aging and so their mid-face is starting to fall a little bit and they're losing that fat in the middle of the face and they want to regenerate that. Fillers really help you to just look younger and just regenerate that great fat that we like to have. This is why babies look so cute, you know, because they have this shiny, cute fat in their faces, and that's what we all want to achieve. As we get older, we lose that, and that's what we want to regenerate with fillers. Of course, nobody wants to look overfilled. Nobody wants to have those huge fish lips. That's not the look that we go for. We try and look as natural as possible. We want you to be the best you that you can be, but fillers are really a great modality to use. So yeah, that would really cover fillers.
Okay.
The other really good current modality is thread lifting. Thread
right.
lifting, thread lifting, yes. Thread lifting uses suture material underneath the skin, and it's inserted underneath the skin in areas where you find that you've got some skin laxity or tissue laxity, and it literally lifts things up. So if, for example, I have a very saggy jaw and I want to make my jaw more defined and I just wanted to not sag, you know, I don't want to have these jowls hanging down,
Mm,
then
Double chin.
a double chin, yes, that's another thing that can be
Yes.
sorted out, you know. Then we put
Yes.
in these special threads just underneath the skin, just with some local anesthetic, and voila, up it goes. You walk out with a beautiful tight chin, and everybody says, "Oh, wow, what have you done? You're looking great." And that's literally done in less than an hour, you know. So
Is it really? Is it painful? You
So
said you put general anesthetic. I mean,
local
when they
anesthetic,
say
local
anesthetic, it means
anesthetic,
there's some pain.
No
It's
pain, no gain.
local. Okay, local
local
anesthetic.
anesthetic. So it literally feels like, I mean, it's better than going to the dentist. I'm sorry to all my dental colleagues. But it's literally
It's much
like putting
better.
a little bee sting, a bit of local anesthetic in the area where you're going to make your tiny hole. And then,
Okay.
yeah, and then that's how you do it. For example, in people that want to straighten the nose, for example, or you want to define your nose a little bit, then you would put a little bit of local anesthetic right at the top of the nose. It goes nice and numb. You insert a little thread in there, and then it just defines the nose, and that is takes all of 10 minutes.
Let's get personal, Doc.
Yes.
You started getting personal. Let's get personal.
Yes.
You see my nose, right?
Yes.
It's not as sharp as yours. Can you lift it to look like nose with what you just said I can do?
Hala, hala.
So yes, it can be lifted. So remember,
I'm asking for a
so
friend.
remember, the important thing is, firstly, you would need to be examined, taken a good clinical history to make sure that there are no major medical reasons why it shouldn't be done. Right. The
Okay.
big thing
Okay.
about aesthetics is it's all about light and shadows. So you want to emphasize specific points and then have shadows to take away emphasis from where you want to take it away, right? So what you're talking about is you want to then emphasize the middle of the nose, the bridge of the nose, emphasize that little point, right? And yes,
Yeah.
you can achieve that with a little thread right there. Easy.
Because we tried doing that with makeup these days, but it's still
Exactly.
not achieved. But now, hence, I'm asking, can I just go? We've got a hybrid. What do they call it? Hybrid eyebrows. Can't remember what
Yes.
they call it. So, will it form part of that? Is it something that
Yes.
will wear off as time goes on, or is it something that I will keep for life?
So it's something that does wear off. The type of suture material that we use lasts probably about 12 to 18 months, but it does wear off after some time. But yeah,
Okay.
it lasts for quite a bit of time. I mean, I have had some people who are like, "Oh my gosh, I'm going to go to a big event, I just want my nose to pop a little bit," and so they do it prior to a big event. And that's what we do.
And now let me take you
Very
up on that one.
interesting.
When you say somebody comes to you because they have an event, how long does the procedure take, and also last this specific procedure?
So the nose thread, we call it a lunchtime procedure. So it really should. I usually schedule my patients for an hour. The actual procedure honestly takes you 15 minutes. We spend more time chatting than doing the actual procedure. But it's really just to create the rapport, make sure that your patient is comfortable, that they're pain free. And then I also keep you for about a half an hour afterwards to make sure that there's no swelling and that everything is good before you go home, you know. But yeah, it takes about an hour, and if there is always the risk of bruising because obviously you've done a little procedure. So I always say if you're going to do anything, make sure that you've got at least a week before your event. It's the same
Chocolate,
with
yeah.
Botox. You won't have any effect until at least a week afterwards,
Mhm.
and then you're good to go.
Awesome. We have a
All
comment
right.
from our audience member, Byron. He's saying, "How permanent is the procedure? Could I have it reversed at a later stage?"
So a thread lift, depending on where it is, it's not permanent. It would usually last you about a year. If there is a problem, it can be reversed, but ideally reversed. But yes, it can be reversed.
So, Doc, I don't know if you can
I
see
think
me
I
here.
think I get what Baron is saying.
Yeah.
Sometimes we make a decision because I've seen my friends going for a certain procedure, and I wanna come to your rooms and get the procedure done. I'm not
Yes.
certain about it. and maybe I don't like it afterward.
Yes,
Can
yes,
I
yes.
reverse that, or will I have to wait for at least the year or 18 months for it to wear off, and then I will go back to my usual self?
So I generally try and make sure that the person really knows what they're getting into and that you really do want the procedure. But should it happen that you don't like it, then I'd say at least give it a month for it to settle, okay? Because it does need some time to settle. Then we can reassess after a month. If you're really unhappy a month later, then we can see about reversing it. Because you may find that if there was initial swelling or something that you didn't like, by then the swelling would have gone away, or there might be something minor that we could just correct or top up or whatever the case is, but yes, it can be reversed.
Okay,
Doctor,
perfect.
I don't know if you can see me clearly there. You see my face is running on mileage now. Which procedure? Which procedure would you recommend for me?
You know, the one thing that I recommend for everybody, and
Yeah.
you have a really nice face structure, I must say.
Oh, thank you.
The one procedure that I would recommend for everybody
Mm.
is to do something called collagen stimulation therapy. I call it collagen stimulation therapy because the term that we all call it is something that just scares people away. Everybody calls it microneedling. Microneedling is not as scary as everybody makes it sound. What it
There's
is,
needle involved.
it's actually we use a little pen with tiny little cartridges that have tiny little needles in them. We set how deep the needles go into the skin, and you put that onto the skin, and that makes tiny little holes in the skin, so controlled trauma into the skin, and that makes your body think, oh my goodness, I need to heal myself. And again, that makes your body create more collagen and create more elastin, and it makes your skin even better and even younger. So that's the one procedure, honestly, that I would recommend for everybody, no matter what it is, whether young, old, whatever. Collagen stimulation therapy is just great. So yes, I would recommend that for you now.
All right. I'll have to
Since
get
you have recommended, Doc,
permission from my wife.
somebody is asking, how much will it cost to go for for that therapy?
So it really
If you're
depends.
comfortable sharing.
Yes, so it really depends. So I'm always so uncomfortable talking about pricing because it depends on the body area that we're treating, also the underlying conditions. So I like to examine the patient. I have a general price list on my website, but I always try and examine the patient. But you can check out my website as well.
Okay. What is your website, doctor?
Okay, so Doc is you're gonna share your website with us, right?
Yes,
At
yes, it's rainestheticsmedical.com.
Rain Aesthetic.
I would love to write that down. It sounded Greek to me. So we hope that our producer is going to write it down, and on our recorded show, it will be on our screen because, hey, I can't. I'm sorry, guys. I'd love to help you. But say people are willing to get a hold of you, Doc. Are you comfortable sharing your offices?
Yes,
Where can they
absolutely.
contact you?
All right.
Yes, yes.
We have, oh, sorry. Go ahead.
So, yes, so my office telephone number is 064 790 1104, and my website is www.rain
Can you repeat it for us, Doc?
064
Yeah.
790
Yes.
1104,
Right.
and the
And
I don't
website.
know whether it's my network, but I'm losing you, Doc.
it's fine. Figile, I'll share it with everyone. And what's your website? Rain's Aesthetic.
It's
Okay, perfect.
Rain Aesthetics Medical .co.za, and all the relevant information is there. The office is in Kyalami, very easy to find. Lots of big green signs outside, you can't miss it.
Yeah. Byron is back again. Question.
Okay.
He says,
Yes.
is there any pain associated with it? This is from a person with extreme fear of needles.
Goes without saying.
Oh, Byron, is this with the nose thread?
I think it.
So,
Oh no, no, the needle.
with the micro needling.
Yeah.
Oh, Byron, I'll numb you. I'll numb you. I'll talk to you. I'll distract you. Very minimal pain.
That's good. That's good.
That's
Those that are
fantastic.
connected on
Somebody
Twitter,
asked on the audience as well, Doc. Oh, sorry, you can go, Noah.
to those that are connected on Twitter, you are more than welcome to type your questions there, and then we can ask the doctor. And Vusi M, welcome to the show from Twitter Day. And we also have Kifilwe, we have Vusi again on Telegram. We are being shown love today. Doc, you must come back again. You moving the muscle.
Oh, wonderful.
And we also have on this platform, Riverside platform, we also have about a few that are also connected. Please type your questions there, and then we can relate to Dr. Kanzi there. So, Dr. Kanzi, um, there's also one treatment that I've seen that had, was on the news. One of the artists, unfortunately, she passed. Skin whitening.
Yes.
Can you tell us a little bit of about skin whitening, the dangers if there is, or any recommendations, or you don't recommend? What's your professional
So,
view on that?
yeah, so skin lightening has always been a little bit of a controversial one.
Yeah.
My Look, I have nothing against practitioners that practice skin lightening. I personally don't practice skin lightening in my practice purely because I am very data driven and I really haven't seen lots of long term safety data associated with the products that are available for skin lightening. So, what is available is showing that a lot of doctors are using and non-doctors as well, in fact, are using IV glutathione, which is an antioxidant, to try and reduce pigmentation in the skin. Glutathione is a great antioxidant. It works to help reduce inflammation in the body. It helps to increase energy, improve immunity. But at high doses, it has also been shown that it inhibits the deposition of melanin in our skins. And obviously, we have melanin in our skins for a reason. That's what protects us from the sun, and there really is a function for melanin in our skins. Now, we don't know what high doses of glutathione can do to the rest of our system. We're not sure if it has a detrimental effect on our kidneys. We're not sure what the long-term effect of having very little melanin in our skins is going to be on cancer risk, for example. So for that reason, I am not too comfortable prescribing very high doses of such a product to my patients. I do give IV glutathione as an antioxidant at very low safe doses for other reasons, for skin brightening, for anti-aging, for energy, that kind of thing. But I personally don't practice skin lightening, so I'm not the best person to comment on that.
Sure. That was my next question. The skin cancer. All these procedures, your dermabrasion, microdermabrasion, laser resurfacing, dermafillers, Botox, chemical peel. Do they have consequences in terms of at the later stage you might suffer from skin cancer?
So again, it depends on how often these procedures are done, how safely these procedures are done, because it also depends on the product that's used, the depth of the peel or the microblading, or the micro needling that's done. So it really depends on the type of procedure that's done. And that will determine what the outcome of the patient is going to be and also future cancer risk. So, for example, in my practice, I do very medium kind of work. I don't do deep peels. I leave those for in theatre practitioners because also that's not really my patient population. If I have somebody that needs such an intensive treatment, I refer them on to somebody who can take it on and monitor the patient appropriately. So, yes, there are risks with everything, but obviously all benefits need to be weighed against the risks. If done safely, the risks really will be minimal.
I guess anything is a risk, hey?
Anything is a risk.
Anything
And
is
again, we go
I
back
was
to
about to
sunscreen.
say as well, that's
Yes,
why you need to consult before you go for
yes,
the
yeah.
for whatever treatment you go for, because you need to assess the risks and
yes.
advise the patient whether it's too risky or not. What if I'm like you? I'm like me. You know, I want it. I want it. Do it. What protects you?
So
Do
if
you
I
go
feel,
ahead with the procedure if I said I want it, and what will protect you as as the practitioner?
so in the end, I'm a doctor, and I do have an oath that I subscribe to, and it says first, do no harm. So if I
Mhm.
feel that this isn't clinically indicated and this is harmful to you, I will unfortunately tell you no. That's
Okay,
that.
okay, okay, perfect.
Doc, I do have
I
concerns.
had a question as well from this side. Actually, they were getting to personal. It's an interesting field that is not often explored.
Yes.
Would you advise somebody, because we know we've got plenty of doctors, but yeah, would you advise somebody who wants to study to go and specialize in aesthetic practitioner, or what is it that you say? Yeah,
Aesthetic medicine.
am I right?
Yes, I
Aesthetic
mean,
medicine.
yes, I think whatever your passion is in medicine, that's really what you need to follow because that's what you're going to be doing every day of your life for the rest of your professional
Hmm.
life. So you need to like what it is that you're doing, and you need to know that this is what you're going to grow into. So if that's what you feel you would like to do, then absolutely. It's a really fascinating field. There's always something new.
Yeah. Especially in us. I mean, I think with your profession, I only heard it happening abroad. I'm glad that we've got you doing it at home. I mean, it's
Yeah.
very interesting. So now tell me, now it's me asking, is it a special, you specializing on in aesthetic medicine after doing so many years of MBCHB?
So
Or
in
you
South
just go
Africa,
straight to it?
So
Hmm.
in South Africa, we don't have an official specialization called aesthetic medicine. We're actually working on it
Okay.
as AMSA. So again, I'm going to go back to AMSA because that's our big association. We're trying to work very hard to try and get it as a recognized specialty and have our,
Okay.
you know, our proper certification. But currently, no, it's not a recognized specialty. We have our congresses and our courses and that kind of thing to try and get it to that level.
Okay.
Yeah.
Perfect. Think that answered my question.
Now, doctor,
Yes.
can I quickly ask? I've known
Yes.
you before the aesthetic treatments. I've known you as a general practitioner, isn't it? Eh? Still,
Yes.
yes. So between that, as a general practitioner and being an aesthetic, what? Treatment
Aesthetic
Medicine.
medicine practitioner. Yes.
Yes, yes.
We've learned something new
Which
on our
which
show
one for you
today.
appeals more, and you see yourself for the next 15 years, you still be on that line.
So it's actually a combination of three things, to be honest. So, I mean, yes, I've known you as my GP patient, and I'm a GP,
Yeah.
and I'm also an epidemiologist. And this is the reason why I was saying I've had a very convoluted path in my career because my big passion is still HIV. And then you would ask me, so how in the world did you get into aesthetic medicine?
My
And
question too.
so what actually happened was that
Sorry, doc. You're saying HIV.
yes,
I'm looking at epidemiology and aesthetic medicine. I mean,
Right.
how do they relate?
And they do, because I
Tell
love
me.
stats, because I
Oh,
feel that it's not enough to just know information. You have to know the numbers behind the information in order to know how accurate your information really is. How reproducible is your information? How robust is your information? You know, because I can give you a study that can tell you any result that you want to say. You know, I can give you any outcome that I want to give you, but I need to know how reliable that outcome is in order to know whether I can believe your statement or not. So that's how I got into the epi, because I needed to understand the stats behind medicine. Okay. And
so you're
so,
more of a researcher.
yes, in that way. And
Yeah.
so what then happened was, one of my long-term patients that I've had on antiretrovirals for the longest time, beautiful woman, started to get old. And she said to me, "Oh my gosh, doc, I'm losing volume in my face. What can I do?" You know, and I said to her, "Well, I suppose you could see an aesthetics doctor and see what you can do about it." She said, "But can't you go and study this and sort it out?" You know? And I said, "No, I'm not going to do that." And then she asked me again. And eventually I thought, well, maybe actually I could. And that's eventually how I got into aesthetic
Wow.
medicine. So very convoluted paths, but they are connected.
Oh, wow.
Okay.
Yes.
Baron
Very
is asking a
interesting,
question.
hey?
Baron is asking a question again. He says, suppose I've always taken issue with my nose, well, his nose, um, which he could have missed the conversation. But he's asking, what can he do and cannot do with his nose?
So, Byron, my best advice to you is you need to be seen so we can do a proper assessment. You know, because it would be quite difficult to kind of make that assessment without actually seeing what we're dealing with. So let's rather see, and then you can make a decision.
Okay.
Mhm.
Yeah.
Baron, is that answer
I
to you?
think all that what you just said to Byron goes to all our viewers that
Yeah.
you, as much as you're making recommendations of what we can do as viewers and guests today, it is best to consult to know what you can and
Mm,
cannot do
mm.
so that
Yeah.
we are all safe, eh?
Absolutely.
Wow, this has been an interesting topic today. I must say, I did not expect it to go this way, and I've learned a lot about these treatments. It's everything that you watch the TVs and overseas programs that you see or learn about them. I don't know, maybe it's just me being stereotyped, but if there's anyone like me, today you have found the truth about these treatments.
You know,
Please
when you
protect-
say you are stereotype, no, I always dispute that. I'm not stereotype. But yeah, I only know that such treatments are done in Beverly Hills. But
Yeah,
today I know that we do them here at
well, that's what
home.
we
Right?
call
You
Yeah.
know, I'm
stereotypes.
so proud of our country. We are so proud of you, Doc.
Particular, that's what we
Thank
call
Thank
you.
you for bringing this at home.
Thank you. Thank you.
awesome. Thank you very much for this beautiful enlightenment on this issue, and we hope your venture, your journey goes a long way, because I see there's a lot of interest in this type of treatment, and now that everything is opening up, a lot more people are going for it. Now, during COVID, did you have a lot of people coming in for these treatments, or we just sheltered away, safe away from anything else? I mean, like any other business, we've had some downs. Other business had the lowest of them all. Hitting the lowest ebb. But how has medical field to your direction been affected by COVID?
So in the beginning of COVID, I mean, during level 5, obviously we were not allowed to practice aesthetic medicine. Our association said that it was just too close contact. And it wasn't an emergency situation. I mean, it wasn't an essential service, so that I could understand. And I also felt that at that stage, what I really needed to be doing was to be treating COVID patients. So I was on the cold face in that way. So I had closed my practice at that time. And then Zoom meeting happened from level 4 onwards. And that was when we were then allowed to practice aesthetic medicine. And Zoom face happened. And I could not believe how the practice then picked up, because we all then started to see ourselves on screen in a way that we'd never really looked at ourselves before, you know. And I mean, even I learned about ring lights and angles and things that I didn't know about before. And then that's when people really started to pick up doing aesthetic treatments. People that were really novices in aesthetic medicine, and yeah, you know, then all of our practice grew from that, because everybody just got to know about it. And so yeah, I think it's been wonderful for all of us. But I think it's also been great for our communities as well, because we've always thought, to quote somebody very close to me, we've always thought that aesthetic medicine was something for there in America and in Hollywood and things that, you know, extremely rich people did. But it's actually not. It's for all of us. It's just part of taking care of ourselves. So yeah, it's actually gone pretty well. We've been quite blessed.
So, do
You've
you?
touched something very interesting for me, Doc. You took it virtually. So were you doing virtual consults? Do you still proceed with the virtual consults even today? Because we know that sometimes we don't have time to go visit the doctor. I mean, we sometimes cancel our appointments because of time. So are you telling me that you still continue doing virtual consults?
So I have stopped with virtual consultations now. I'm doing everything face to face, because it is still easier. It's you can touch the person's face, you can feel the skin texture, you can really see what's going on. So it is still better clinically to be able to touch and feel, and also interact with somebody. You get a better rapport face to face than you will virtually. You know, so yeah.
Yeah.
Now, Doc,
Okay,
one of these
perfect.
procedures, does it limit you as somebody? I didn't want to, say a gender, but if you putting on makeup, like, I'm a photographer, and sometimes my clients would want to put on makeup. If they have done one of these procedures, does it affect them, or it's fine, they can go on with their makeup, or is there a type of makeup that you need to have for that?
So after having an aesthetic procedure, in general, I would recommend that you not put on makeup on the same day, at least for about a day or two after you've had a procedure, especially something like a peel or microneedling, just to give the skin a chance to really heal, you know, because you've done this exfoliating kind of procedure, and you've also applied really healing products. So you don't want to add in products that may cause inflammation or rashes or anything like that. So usually for about, a day or two, I'd really recommend that people don't put on makeup. But after that, they can go back to their normal lives.
All right, another question from our
Okay.
audience day. It's Byron again. Byron, hey man, you're getting 5 stars. He says,
I
he
think
says, "Pardon
Byron wanted to join us on studio.
I
actually,
think
we
so.
have invited him, right? But he says here, he pardons, asking for pardon for many questions that he's posing. But he says, could I use aesthetic medicine to work on some features that are a result of obesity or being overweight?
You could, Byron, but again, it also depends on the underlying condition. So aesthetic medicine can help in a number of ways, but again, obesity as well is also a clinical condition. So it's really important to have that clinical consultation in conjunction with the aesthetic medicine to really get a good overview and so that you can have a really good clinical plan which includes aesthetics. Because remember, you're one person, you're not an aesthetics person and a clinical person, you're one person, so it needs to be one plan.
Okay. Well, thank you ever so much, everyone, for this beautiful discussion that we have enjoyed. And this is the music that I dedicate to Figili. She hates it, but unfortunately, we have to play it. We've come to the end
I
of our
don't like
show.
it because it reminds me that I was talking a lot again today. So, yes,
No, no worries. Today you were very good. Thumbs up for that, Figili.
thank you.
So, Doc, your last closing words. What can you say to our audience there?
I'd like to say, please investigate aesthetics medicine. It is very, very interesting. Don't limit yourself. Don't be stereotyped about it. Please, the sky's the limit. Investigate it. It's very interesting.
Thank you. That was nice and sweet. Short and nice and sweet. Figili.
I mean, no, I hate times where we have to stop talking. But hey, thank you to our audience today for joining us. Again, thank you, Dr. Liseho. I mean, you've enlightened us in aesthetic medicine treatment. Oh, it was Greek to me, but today at least I'm enlightened. I'm not saying anything on air, but yeah, expect my call. I told you about my nose, but thank you very much for everyone who joined in today from our TikTok viewers. Thank you very much to you, Noah, as well. Thank you for hosting us.
It's always a pleasure to host lovely ladies like yourselves and who are very insightful in these matters that I'm not. What I'm taking away today or this evening from you, Doc, is I can do collagen stimulation. Ha! This I have
Yes,
I have to talk to you about it, but I need
I want
to
to, she said there's green treatment. What is it again, Doc? You said
a
there's something
green
green treatment?
peel.
a
A
green tea.
green
It's a
peel.
green peel.
Yes,
Is it a
You said it's
peel
the
or a
basic.
peel like a tablet?
peel is a
Uh,
peel.
oh yeah, a peel,
It's
a peel.
Yes,
peeling.
yes,
Peel.
All right, thank you.
P-I-P-E-E-L. Peel.
yes.
All right, thank you, everyone. Enjoy
Thank you
your
very much,
what's left of
Doc.
your
Thank you
evening.
so much.
Yeah, and thanks for joining us. And everyone that has connected on Telegram, we thank you as well for joining us. We had audience also on Twitter. Thank you for joining. And Byron, you getting your 5 stars today for, representing everyone out there with those questions. Except for you, hey. I wonder if I do have a 5 star.
This goes to Byron today.
All right, thanks. And this is Neo Morapedi and Figile Nkosi, and this is how we sign out. Leave it internet and leave this.
Fluffy.